of this. So first, if you could just tell us a little bit what a midwife does, what's the role of a midwife now, what do you think about the hospital, the doctor, the obstetrician, of which we have one here, and the role of the midwife?
Well, the midwife basically does obstetrics and gynecology, not just obstetrics. That's not talked about enough. And basically gives the same prenatal care that the doctor does. It's the same standard of care. It's not a different standard of care, it's a different standard of caring. We usually give the patients a lot more individual time and care and questions and involve the family. But it's the same standard of care as the obstetricians does. It's ACOG standard of care. Okay, and then we deliver them. We follow them in labor and we deliver them.
What do you find is the biggest difference, though, in your opinion, of when a patient goes to see a midwife as opposed to coming to see me? I know you said that you spend a little more time, or you feel that you spend a little more time in the office with them. What about the hospital experience? What do you think is different there?
Well, not to categorize all physicians, because I work with physicians all the time and don't have a problem with it, but when I send the patient in for admission, I follow. And I'm there the entire labor, and most of the doctors just come in towards the end, or if there's a problem. Okay, I also assist at the C-section if there is a C-section, and not all midwives do that, but I never give up my patient. So I'm there the whole time. But again, it's the same standard of care.
And why do you think that is? I mean, when you tell people that you're there the whole time, it sounds kind of like the doctor's abandoning the patient.
No, I don't make it negative.
No,
You're
but
making it sound negative.
Why do you think they're not there as much?
Oh, that's their choice.
Right.
I'm sure many doctors are.
Right.
But they're busy, or they're doing something else. They're doing GYN surgery, and they come up from surgery. It's just a different...
It's a different dynamic.
Type of practice.
Yeah.
I mean, I'm a solo private practice. I don't share my call with anybody. So I'm there for my patient. I just reschedule the day if somebody goes into labor when I have other patients, whereas a lot of physician groups are groups. And so one doctor will be on call Monday and Wednesday, and another be on Tuesday and Thursday, and so that's why.
Right. Now I'm going to say something a little radical, because I've heard people saying that there may be a swing in the future. You know, you have the Obama health care plan coming in. It looks like it's focusing a lot on saving money. Could you envision in the future, because I've had my colleagues, where most of the deliveries in the hospitals are performed by midwives, and then the obstetricians are doing more of the surgeries, the C-sections, the gynecological surgeries, and that things are going to be divided more like that, just as far as efficiency?
Well, it sounds very great in theory, but in practice we will have to train and school a lot more midwives, because we don't have
nowhere near that capacity.
No place near that, and no place near that. So that may be a goal, but it isn't really happening yet.
Well, let me backtrack for a second, because I think a lot of people think about midwives and don't even associate it with the hospital at all. So are all the midwives in New York City, are there midwives who are birthing at home? Are all of them birthing at the hospital?
That's
What's
a really
the general
good question? I think we should clarify that home births account for less than 1% of all deliveries in the entire country every year. So we have 4 million deliveries, just over 4 million deliveries every year. So less than 1% are home births.
Okay.
So we're talking about 40,000 across the entire country. They get a lot of attention, but they're not.
They get a lot, and you hear about a lot of celebrities. I mean, I think I heard Cindy Crawford. I could be wrong. Correct me. Birthed at home. I mean, tell people. I mean, I'll tell you. I get a little frightened thinking about that.
It's really frightening.
Yeah.
If something goes wrong. If everything goes well and there's no problem, there's no problem. It's wonderful. But if there's a problem, you just want to be in another planet.
Exactly. And even if there's no problem, I know we did it in the past. People say, what did we do before there were hospitals and doctors? Of course, we all gave birth at home. But just the thought of, perhaps pain management, and I know there's alternatives, but the pain management, being stitched up, at home, just even someone who's not a doctor, let's say a person. It's a little bit frightening. What are the kinds of patients? I mean, perhaps you don't do home births.
I definitely don't do home births.
So I'm sure you know people who do, though. Who are the patients who are attracted to home births?
Very nice patients.
I'm sure they're very nice.
But they want control. They want control. They want control of the environment. They want to control. They want a home birth. They don't want the hospital experience. They don't want medical interventions. So for the most part, I have a difficulty with it, and but my difficulty is because sometimes their goal is a problem. This is it. My goal is healthy mom, healthy baby,
Yes.
positive emotional experience. The goal of somebody at home may be the experience over the health of the baby and the mom, because you're not monitoring very much at home. And some of the moms that want to deliver at home don't want monitoring. It's not just the midwife. The midwife may be very willing and very anxious to monitor the baby,
Right.
and they're saying, no, 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 it's okay, my baby's fine. And in truth of fact, many emergencies occur at the end of labor.
So,
During
so
labor
for
and
the
at the
record,
end.
would you say you're against home births?
I'm a little uncomfortable with it. Okay, but remember, it's less than 1% of all deliveries. I
Right,
think that
and
should be the less than 1% includes
In the United
birthing-
States?
I'm only talking about the United States.
Only in
Less
Stein,
than
New York.
1%
New York's
are
zero.
all the birth center deliveries and the home birth deliveries.
Okay.
So it's a very small number.
Okay.
It just gets a lot of attention.
One more question. If somebody wants this done, do you accept insurance? How does that work? How are you paid
Me?
for your services?
That's true. If
Yeah,
I want to, let's
midwives.
say my sister wants to deliver with a midwife, what's the best way to get in touch with a midwife?
Well, you can go on the acnm.org website, or you can go on any of the local websites and put in midwife.
And just do a search.
You do a search,
And then it's
they can
their
check.
website's
In other
gonna
words,
come up.
I accept 15 insurance companies. Okay, some midwives don't take any. You know, so if you have insurance and you want the insurance,
So they don't have
cover
to
it.
worry about paying out of pocket
No,
if
not
they
at
deliver
all.
with you.
No.
So that's actually a relief because,
Right.
you know, I'm
Right,
sure
because
people...
it sort of has become this trend of the stars and the rich, and I just wondered what the options were for people really who don't have money, who may want to choose a midwife as opposed to
Well, most of the city
hospital.
hospitals have midwives on staff. It's not a private practice, but you can get the care of a midwife as long as you're low risk or essentially normal.
Okay.
Okay, like all the city hospitals, some of the voluntary hospitals have midwives there as well.
Now, I have